Good afternoon, everyone, and welcome to our Primetime Alive program on the importance of posture with aging. I'm Vicki Newell with the Primetime Alive program. So glad you could join us this afternoon. A couple reminders. Number one, yes, we wear masks here, but we're in a very large room and can keep our distance, so you can understand us better. We're not going to wear those today. And then number two, if you want to ask a question, if you look in the upper right-hand corner of your screen, I'm going to kind of point out here. See this red arrow that I have? You should have something similar to that. If you just click on that red arrow, or whatever color it is, it'll open a box. Towards the bottom of that box, it'll ask for you to type in your question. And so we will get to those questions at the end of the presentation. All right, we're going to move on and introduce our speaker. Our presenter today is Celeste Small. Celeste received her doctorate of physical therapy from the University of Pittsburgh. Her primary population that she serves is those with neurological conditions. Celeste has been a physical therapist for 11 years and has been at Mary Greeley Medical Center the last 2 years. Please welcome Celeste.
Okay, I'm going to unmask. Well, thank you guys for having me. This is a little bit strange. I miss seeing all of your faces. I was actually here last year and enjoyed being a part of the program. So I definitely missed your faces, and this is different. But hopefully next year we can be back together and in person. I look forward to these talks because I do actually enjoy community outreach. So I really hope that this is beneficial for you. So I was asked to present on postural changes in the elderly. It's a great topic, but really it's a great topic for all of us and not just the elderly population. Actually, I think if we were as a society if we paid more attention to our posture, the younger we are, the better off we'll be. But I'll speak today specifically to those that are 65 and older, but it really does not just apply to that population. So if you have grandkids, great-grandkids, talk to them about using their phone and slouching on the couch, because it really does have a long-term effect on your quality of life. So we'll move on. So, according to a study done by Gong et al., body posture is a fundamental indicator for assessing health and quality of life, especially for the elderly population. So, when we talk about health and quality of life, really, body posture affects all of our major systems. So, if we start talking about our cardiovascular system, so we're talking about our heart and our lungs, how does body posture play a role in affecting efficiency and our quality of life and health? So we'll talk about your typical posture that you see and you say, that doesn't quite look right. So in a slouch posture, okay? So this is me slouched from the front. This is me slouched from the back. But also, my knees are slightly bent. With that, with just being slouched, we talk about our cardiovascular system. So let's talk about breathing. So when we breathe, our diaphragm actually needs a lot of space in our thorax, which is here, to expand and collapse to really perform optimally. And when we breathe, the quality of breath is really important. It helps with the quality of oxygenation that we get to our vital lungs, our vital organs, such as our heart, our brain, but really even our liver, our kidney, all those really big, important organs that we need to be healthy and be active. So then let's talk about the heart in particular. So when we sit with a flexed position, we actually compromise the efficiency of our venous system, which we're talking about our veins. So our veins actually has a mechanism that gets our blood pressure up to our head, and that's how we don't feel lightheaded when we transition from maybe sitting to standing or from laying to sitting. And without that great mechanism, We tend to get lightheaded, but we can also get varicose veins, which affects the efficiency of our venous system. So right there, we're talking lungs and heart. Big organs, big important organs for us to be healthy and functional. But really, it affects more than that. It affects mood, it affects fatigue, it affects your ability to be interactive with your loved ones and your friends, your ability to be sociable. So let's talk about fatigue. So when our muscles are overly stretched in a not so great posture, maybe our head is a little bit forward, our shoulders are a little bit rounded, our knees are a little bit bent, then we start to, what we say is compensate. So we start to use different structures and muscles that aren't intended to keep us upright in order to compensate for that poor posture. So with that, those compensations actually put stressors on those muscles that aren't intended to be used that way. And with that, you get fatigue. Those muscles get tired really quickly because that's not their job. So it becomes more energy demanding for you to sit up straight, more energy demanding for you to walk across the kitchen, to walk from the couch to the bathroom. So it affects fatigue. And there was actually a study done, and I don't remember who did the study, but it was actually discussed in the U.S. News and World Report, a study done where they had people actually providing talks and lectures, and they had a group talk in a slouched position and a group talk in a more upright position. And the psychologists actually looking at that study, the people who were more upright, they had more energy and they had more positive body awareness. Basically, the theory behind that is they were paying less attention to aches and pains. They were paying less attention to, oh, where is my body? Does this hurt? Does that hurt? It was just easier to interact and engage with others. And truly, the list goes on and on. But let's talk about the forward head positioning. And I really go into this one a little later. So I talked about that head being forward. And this is absolutely the worst thing, I think, because it affects so much. And what's more important to remember is what happens up top affects what goes on down below. But let's just talk about what happens up top. So when her head is so far forward on her neck, you can even have pain chewing. Who would have thought, huh? So pain chewing with a forward head, why does that happen? Because her skull is connected to her neck, and we have something called a TMJ joint, which is directly connected to the skull. So we get just overstretched muscles and ligaments that aren't intended to work that way, creating pain, creating popping, creating shifts in our TMJ joint. So now we're talking about basic functions, so eating, all because of posture. How interesting, right? Okay. So they actually found significant differences between women and men with respect to the angle of the neck, the thorax, and the hips. The study I looked at didn't specifically go into those changes, but know that we were all affected by posture. So I did all that talking about posture and different things that can be affected because of it. But what is posture? So posture is the alignment of body parts in relation to one another and the orientation of the body to the environment. Gravity affects subtle shifts in weight and body alignment, and this affects our static and dynamic postural control. Maintaining postural control is necessary for safe performance of many daily tasks, just like I just mentioned. So the alignment of one body part on the other, but I don't just think of posture in this plane, so not just what we call the frontal plane, which is as you see me. Posture actually has what we call a side sagittal plane, so as you see me from the side, but there's actually rotational components to our posture as well. It does not affect just the way your head sits on your neck or how your neck sits on your thorax or lower back, but the way your hips sit on your feet. So it's all the way up the chain, down the chain. You wouldn't believe how important the posture in your feet, how important it is. Really, it affects a lot. And I'm not going to give you too much because I'm going to talk about it a little bit more. And we speak specifically about gravity, right? Our posture as we sit up is very different from our posture as we lay down. Know that we can have abnormalities in our posture as we lay down. And it's equally as important to manage that. And when I say managing our posture as we lay down, how do you lay? So do you lay with 4 pillows under your neck? Do you lay with 3 pillows under your knee? Do you sleep on the side? And I don't know how much you can see me with your knee kind of collapsed in. It affects how you feel. It affects our different structures in our body, so our muscles or ligaments. It adds different stressors to our body depending on what you do. So our habits affect our posture. But as we sit up, gravity, like it does to everything else, has a downward force on our body, which requires our muscles, primarily our extensor muscles, which are the ones in the back, to work, be happy, and be healthy. The less we are aware, the less we use them, like everything else. You don't use it, you lose it. Things can go awry. And gravity has a downward effect on our posture. But really, our environment also has an effect on our posture. More specifically in a dynamic position. And when I say dynamic, I mean as we move. So, the biggest difference I can tell you between me standing just on a flat surface and then me navigating up an incline is the incline shifts my posture back. So I have to have really strong leg core muscles to help keep me upright as my environment, i.e., the incline has shifted me back. So it's not just gravity that has an impact on us. More dynamically, our environment in terms of the grade in which we walk on maybe a slope, an incline, even maybe on ice. We tend to shorten up stuff, get a little smaller, a little closer to the ground if we're navigating icy surfaces in the winter. So it's not just gravity. And it's necessary for us to do simple things, right? So walking and maybe carrying your grandchild or your great-grandchild, okay? So if you're holding a baby, what happens when you hold a baby? You kind of fold a little bit forward, and then all of a sudden you're shifted forward and you're walking around, navigating your environment, a little forward shifted. So your body has to be able to accommodate all the requirements of your daily activities. And those are all postural muscles. So like everything else, we're all interconnected in more ways than one. But I do like to, if I haven't said this already, I'll say it again. I think posture is an underrated topic. So I said I would talk specifically to the elderly population. I think age is just a number, but according to our geriatric guidelines, elderly is 65. But especially in my field, I see so many 65-year-olds that I'm like, you're not old. But when I say elderly, I'm talking 65. So as we get beyond 65, our normal postural alignment shifts because of several reasons. And we'll talk about that. But what we typically see as we age is the rounding of our upper back. So more around where the shoulder blades are, we see this rounding, okay? We also see the forward head positioning, and we also see a shift in the lower back curve. And I don't know how much you can see me, but you can either see an excessive curve, so an excessive arch in the lower back, or you can see a reduced curve in the lower back, so a flattening of our lumbar spine. But you can see either of those two things, and really they happen for different reasons, and I'll get into that. And we also see a rounding of our shoulders, then flex knees and flex hips. We also see changes in the feet, like I mentioned, and we'll go into that. But you can either see your arch in your feet flatten, or you can see them come hyperactive and what we call have supinated feet. And it affects you in different ways, and I'll speak specifically to that. So I know many of you may hate this picture, because I would, but this is typically what we see with age. So the flattening of the low back, like I mentioned, the flexed knees, the flexed hip, the forward head. Yeah. So this looks painful, and it probably is painful. So what causes these changes? I will say that a lot of these changes are multifactorial, and sometimes we just don't know why these changes happen, but more specifically, hyperkyphosis, which is the rounding of the upper back, and I may need to jump over and grab my water because I'm getting dry, sorry. We don't know why it happens. It happens for different reasons and different people. So one shift that we do see is we do tend to see compression fractures, okay, in your vertebral bodies, which are the bones in your spine. So, and we typically see this with osteoporotic changes. And what are osteoporotic changes? It's kind of the weakening of the bone structure, okay? And that can happen because of genetics. It can happen for an array of reasons, and I'll speak specifically to that in the next slide. Our extensor muscles get weak. You don't use it, you lose it. You sit chronically and you slouch. Maybe you have a favorite recliner chair that you like to sleep in, so you get a lot of stretching of your extensor muscles. The more you lengthen a muscle, the harder it is to produce a force, because when a muscle produces power or a force, it shortens. So when you have long, what we call extensor muscles in the back, then it's really hard to get upright. So, and even if you're able to get upright, those muscles work over a long period of time, so it may be hard to sustain being upright. Decreased range of motion. Usually with time, what happens is the disc in between our joints just loses the water content, and those discs tend to flatten. So it's why we would see people come in and say, I used to be 5'6", but now I'm 5'5", and I don't know why. Just over time with wear and tear, those discs lose water content. Our ligament structures that are there to stabilize us, they tend to become more rigid and less flexible. So with that reduced flexibility, it's just hard for us to get sufficient range of motion. But also, honestly, if you're standing like this, it's hard to get rotation around your spine as you walk, because you're so far curved, and a lot of people start walking and there's no arm swing. And actually our arm swing when we walk is really important because it allows our spine to rotate. It's not super big rotation, but it's important rotation because you have constant mobility in your spine as you're walking. So loss of spinal flexibility. So I said, those extensor muscles work, well, if those extensor muscles work, you can pull out of that flexed position, but some people can't do that. And that's because it's more of a bony structure problem. So no matter how we as physical therapists push on you or how much your daughter may whine and say, okay, come on, sit up. You're like, I am sitting up. This is as far as I go. And that could be just lack of that flexibility in your spine. And that's because maybe your ligaments may have just lost the extensibility with aging. Okay, so degenerative changes in the spine, ligaments, tendon, and intervertebral disc, which I touched on already. So the tendons, the same thing happens. So it just becomes more rigid. It's less water content, so you have less mobility. All of this that I have mentioned can result in pain, okay? Because you may be overstretching muscles and ligaments that are not intended to be at that length. And with overstretching those structures, you get pain. With lack of constant mobility in your spine, you get pain. So a lot of this can result in pain. So I mentioned osteoporosis. With age, you may not be osteoporotic, or you may not have osteopenia, which is the precursor for osteoporosis. But as we age, our bones, the mineral content decreases, they become less dense, and they become more fragile. As bones lose mass, this is when it can become very problematic, and you can have osteoporosis. It affects women and men, and you can, what we call that downwager's hump, which is that big hump kind of sitting in the middle of your shoulder blades, so you can get that. But what is more important is osteoporosis puts you at risk for compression fractures. And then with aging, cartilage, which I mentioned, you have less cushioning in between your bones, there's less water content, and with that, the cartilage becomes more susceptible to stress, and arthritis can develop. And I mentioned this already, ligaments, connective tissue between the bones become less elastic, and you have reduced flexibility. Joint motion becomes more restricted, and flexibility just naturally decreases with age. I have a typo there. It's supposed to be with age, not aged. So again, what causes the flexed or stooped posture? Chronically overstretching neck, trunk, hip, and knee extensor muscles. So the muscles that are there to help you what we call extend or be upright. So habits, just going through your daily life, can really affect this flexed, stooped posture. So I mentioned this, sitting in your favorite recliner for hours and hours on end, and these are the times of COVID and quarantine and staying home. So it's easy to get into this flexed posture, and it's easy to sit and be entertained by the television. And then there are those that don't really have a choice. Maybe they're wheelchair users and they need to sit to be functional. You are at risk for the shortening of tissues, but maybe that doesn't really affect your function as much, because if you're not walking, maybe it's okay that your knees and your hips are tight because you don't have a need to extend, except when you're transferring. It's easier to transfer if you're extending, and transferring means moving from one surface to another. So going from your wheelchair to your bed, etc. So, and if you are sitting, how are you sitting? Do you have good lumbar support? Are you in a chair that pushes your head way forward? Or are you able to kind of get that head back and retract your cervical spine? How are your knees coming up past your hip, and really getting you in that slouch rounded position in your lower back? And then we talked about poor sleeping position, maybe using way too many pillows under your neck. Sleeping surface, where do you sleep? Do you sleep in bed? Do you sleep in a recliner? Using pillows under your knees. And I will have a caveat to that. If you have crossed the threshold and you have severe stenosis or degenerative changes in your lower back, maybe that's where you are and you need to manage your pain by putting pillows under your knees. So I like to add that caveat because all of our bodies are different, especially as we age. Some people may have low back pain, some people may not. Some people may have shoulder pain, some people may not. So, as a healthy individual, if you have no aches and pains, putting several pillows under your knees is not a good idea. If you have those fancy beds where you can adjust the head and move the knees, trying to be as flat as you can without problems is probably a good idea for you. And really just going into that extended position throughout the day, if you do an exercise regime or you have a workout program, just laying flat, getting your head back is a good way to just stretch it out. And then inactivity, so not exercising, that's a sure way to get that stooped posture, because chances are if you're not exercising, you're probably sitting. And ill-fitting devices that we use for walking, so maybe a cane that's too low that's causing you to bend forward as you walk. Think about that every time you stand up to get around, you're in a slouch position. So just making sure that your assistive devices are appropriately fit. And the same applies to wheelchair users. You know, if your knees are coming past your hips in a sitting position, maybe that wheelchair is not fit appropriately for you. So just talking to your healthcare providers, you should be at kind of a 90-90 degree when you sit, okay? And then to get a spinal neutral position in sitting, I always talk about those sitting bones. So those bony prominences, when you sit, we all feel, they should be pointing straight down when we sit. So if they're pointed back, you're putting too much strain on your low back. And if they're pointing forward, you're probably in a slouch position. So as it applies to when we stand, same thing applies when we sit. Those bony prominences that we sit on should always point straight down. So if you're sitting in a chair and you're like this, those bones are going forward. So you need to find a way to get yourself upright, even if it's using a lumbar pillow to help you out. Okay, yeah, and forward head positioning. So I talked about it affecting the TMJ, but it's so much more than just the TMJ. So social engagement, it really affects your ability. If you're forward head and you're slouch, it affects your ability to even just gaze up. That hurts me to do that. I can't tip my head up. To look forward and look up. And then it really affects the load distribution of your vertebral joint spaces, and it can lead to what we call spondylosis, which is just a narrowing of the joint spaces in between your spine, so your vertebral bones, and it can lead to compression fractures when you have weakened bone structures. Cervical spondylosis is super common in the elderly population, really, because the forward head positioning is super common. It's a source of pain. It's a source of stiffness. It limits range of motion of the neck, which is super important for navigating your environment. Okay, you need to, when you're driving, you need to be able to look over your right shoulder, look over your left shoulder. You need to be able to look up when you're walking. You need to be able to look forward. Researchers found that people with spondylosis have signs of instability in stance. And I'm sure it's because there has been an anterior shift in your center of gravity. So you have your forward head, you put more weight on your toes, and it's just harder to get your balance maybe when you get shifted back by walking on an incline, hitting that little ledge to get from one room to the next. So it's funny how this is all interconnected. I wish sometimes our body parts operate in a silo, but it doesn't. Everything is connected, and it affects one thing affects another thing that you would never think of, affecting the ability to explore your environment, affecting your ability for obstacle avoidance, and again, decreased spinal mobility, flexibility. All of it interferes with the normal strategies needed for static and dynamic balance. and I'm not even going to hit on this because this is another big area, but our mobility in our cervical spine actually plays a big role in our what we call vestibular system, which is a big balance system that connects our eyes and our brain, and it tells our body what to do, but it gives the brain a lot of information about when our head is moving right and left, we should be able to stabilize what we're looking at. And that's all coming from the neck. So our we call it proprioceptors, but our position sense signals has to tell our brain where we are in space. So it can affect your balance, oh my gosh, on so many levels. So we'll move on. So a picture of cervical spondylosis. I threw a big word out there, so I just wanted to give you a picture of those changes. So the top is a healthy cervical spine. The bottom, because of the spondylosis and the changes, you're seeing a bulged disc. Oh no, and the picture cut off. You're seeing a narrow disc, so there's decreased spacing in between a joint. You never want decreased spacing in between a joint. And I think below there was a nerve that was being compressed because of the narrowed joint space. You never want a nerve compressed because then you get symptoms down your arm and you get symptoms further out from where the injury is. And it can be very debilitating because not only do you get pain, but you can get weakness and affects your sensation. So maybe some numbness and tingling. So other causes of postural shifts. Muscle weakness, maybe because of a neurological condition. Maybe you had a stroke that affects your right side, and you can have some abnormal muscle firing, which causes one side to be more flexed than another. Our stooped posture, flexed posture is super common in our Parkinson's individuals. A shift to one side, we call it the Pisa syndrome, is common in our Parkinson's individuals. So more reason than one to have postural changes. Arthritis affects the way we do things. Maybe we are in pain avoidance mode, so we start shifting one way to avoid hurting. So, maybe we're using pillows under our knees because we have arthritis in our low back, which is fine, but then we end up with shortened hamstring muscles and you just can't get the extension that you need in order to be upright, but you're accommodating pain. And we see that a lot, shifts in posture to accommodate pain. And then we also scoliotic curvatures. So maybe when you're younger, somebody probably just noticed it doing your checks in school, but as you age, structures get lengthened or weaker, and that curvature can get worse. Maybe one leg is shorter than the other because you had surgery on one knee, but not the other, or surgery on one leg and not the other. So one leg is longer than the other. Now all of a sudden you have a little bit of curve because you have different leg lengths. And then in terms of the extremities, just rounded shoulders, which is kind of a big deal because it affects your overhead reach. That forward head, rounded shoulders affects the ability for your arm to go past your shoulder, which affects your function. You got to reach overhead for the coffee cup. But in more ways than one, everything is connected. We see flexed elbows, flexed hips, flexed knees. We talked about that. What we call varus and valgus deformities, there's a picture of that in the next slide, so I'm not going to go into that a whole lot. Those are usually a result of arthritic changes, or maybe you were just born that way. And muscles got weaker because they were in a stretched position, and I'll actually just slide to that so you know what I'm talking about. So our varus is kind of your bow-leggedness. Our valgus is your knock-kneed. Maybe you're born that way. I'm a little knock-kneed. That's how I was born. So I work really hard to keep my outer hip muscles strong because I know my knees will need the extra stability, because if I'm knock-kneed, then I'm going to get more wear and tear. You guys can't see me pointing to the screen. I don't know why I'm doing that. So more wear and tear on the outside knee. Maybe I can. I don't know. because the bones are hitting more so on the outside, and then on the inside, when you're bow-legged, you get more hitting, so you get more wear and tear. So really, posture alignment that's equal is really important, because asymmetries usually result in arthritic changes. Again, the varus deformity, that foot tends to be higher up, that's what we call the supinated foot. And in that knock-kneed position, the feet are collapsed. And it affects our functional mobility in different ways, which I'll speak to a little later.
You can use the pointer with your mouse to point.
Oh, okay. Thank you. Thanks. Good call. So yeah, with knock knee, you see just a little bit more narrowing of the joint spaces here. And when you're bow-legged, you see more of a narrowing of the joint spaces here. It's actually why they're calling it hemiarthroplasties. The orthopedic docs are now replacing half of the joint in knee replacements, which is a little less invasive. You recover a little better, but it's because of deformities like this is why we may see asymmetrical wearing of joint spaces in our joints. So in terms of the lower limb and foot, different things can kind of put you at risk for problems with your foot or your knees and your hips. Shoe wear. So if you work at Walmart and you choose to wear Crocs to work, you're just not supportive shoes. You may have, if you're standing on your feet all day, your arch that's intended to support your weight can just get collapsed if you don't have proper support. If you're overweight, the same thing happens. So it's just excessive weight for those kind of passive structures to carry. And then we have muscles in our feet. We call it the intrinsic muscles in our feet. Those muscles need to stay strong in order to carry that weight. But people who don't wear proper support, or maybe they have excessive body weight, we tend to see a lot more pronation, which is the collapsing of the foot. Your job, as I said, working at Walmart versus sitting at a desk, the demand on your feet is different pending what your job is. And then your physical activity, were you a runner all your life? You didn't take good care of your feet. All of a sudden, maybe you have hammer toes or you have a bunion, and maybe you can't get your big toe to extend the way it's supposed to, which is it's important. So all of this is, affects the way our feet are aligned. Were you a football player or a basketball player? Like my husband, for example, college basketball player, had surgery on one leg, but not the other. Now one hip is a lot higher than the other, and he refuses for me to adjust it and give him a heel lift. So he's going to have back pain down the road. Hopefully he never hears this lecture. So we talked about foot problems. So elderly people with foot problems tend to report falls. It's a big deal, right? Falls are a big deal. Reason being, if your feet are flat, you have less stability when standing on one leg. Well, you say, I don't stand on one leg. Yes, you do. We all stand on one leg. When we navigate a threshold or we go up and down stairs, there's a brief moment where you need to stand on one leg. Getting in and out of the shower, we need to stand on one leg. So people with flat feet are at more risk for losing their balance when they go into that, what we call unilateral stance positioning. People who have the high arch support, they're kind of just hanging out on the edge there. So maybe their lateral stability is not as great because they're kind of starting at a shifted position. And this happens because it's just a change in the muscle activity in our feet. We tend to get different compensations, which may stretch the arch a little bit more. But it's a big deal. And then our feet get tired. If you don't use it, you lose it. So the muscles in our feet may get weaker, and it's easy to get muscular fatigue, which can affect our balance. So foot posture is just as important as the forward head posture. So external causes of change. So if you got into a car accident, I don't know, you had whiplash or you had some kind of injury to your neck, Maybe you had to have cervical spine surgery, you're in a collar, you don't have the range of motion. Then you get compensations and you get shifted forward. So that's an example of a car accident. Falls. You fall, you broke a hip, you had to have hip surgery. All of a sudden now, one knee is going in a little bit more, maybe because you didn't do enough strengthening to have that lateral stability to be able to pull that knee out. So any kind of damage to your musculoskeletal system can result in postural changes. And of course, if God forbid you had, I don't know, a brain bleed or something like that that affected your neuromuscular system, you can have postural changes. So if you're not active, like we spoke about before, people doing a lot of desk work. There are people working from home, sitting at a desk for 4 hours and then just getting up for a break for lunch. Just making sure that you're giving yourself more breaks. You're standing up and stretching. Your chair is super ergonomic, so you have that neutral spine positioning. You're not rounded, you're not reaching for the keyboard, but if you are, that can affect long time doing that for years and years. If you have a desk job, that can affect you. And then of course, look at this guy. What's he doing there? How does his neck not hurt? It probably doesn't hurt now, but it will hurt when he wakes up. But your sleeping positions, and I try to get everybody out of the recliner, because that's where you see the bent knees, sleeping in the recliner, the bent hips, the curved back, and then the forward head. So it's the super comfy chair. Usually people end up sleeping in a recliner because something hurts and it just feels better to be there. They stay there. They don't address the problem. Then you can't get out of it. It's just this cycle. Sitting on your favorite spot on the couch. Maybe you like to lean this way. So you're always shifted to the left. And, wearing high heels put your knees in more of a flexed position. So our habits can affect our posture. And then your grandkids who text or they're on their phone all day or whatever. Maybe you guys are on your phone all day and not being mindful to maybe bring the surface up to you as opposed to meeting the surface. Who cares? By now you should care. I hope I have emphasized the importance of posture. So now you know why posture is important. It affects mobility, it affects balance, you can have falls, your social engagement can be affected. You sit like this, it's just harder to talk to your friends across the table. You sit like this, it's easier. You don't have to worry about your neck hurting or, do people think I'm slouching? Are people paying attention to my posture? So it affects social engagement. And I talked about how important it is for you to have that efficient breath so your vital organs can be efficiently oxygenated and so we can be healthy. And then muscles get weak. They become overstretched and they just get weak and then you get pain. So you should care. I'm going to skip this slide because I kind of hit on it a little bit. So control of body and balance. So I talked about it a little bit, but balance is really an integration of three main systems, right? We have to see our environments to know the needs on our body. So you see ice, you're going to shorten your steps. You're going to go slow. You're going to slow it down. You see an incline, you might have to pick your feet up a little bit more. Okay. We need to compensate. Well, not really compensate. Adjust is the better word. Adjust to our environment. And our eyes is what gives our brain the information in terms of how to adjust. I talked about our vestibular system, which this main system is housed in our inner ear, but it's really a big communication between our eyes, our inner ear, and our brain. And then our brain sends output to our body to response. It's the system that gives us information about our balance as our head moves right and left, as we have linear acceleration, deceleration. Why does that matter? I talked about the cervical spine. If you have a restriction in your cervical spine, then you never use your vestibular system optimally. You don't use it, you lose it. And then you have to be able to feel, which is our somatosensory system. And then we stay upright by coordinating all this information, but more importantly, there's output, right? Our brain tells our legs what to do. Our brain tells our trunk what to do. We have to have the capability to do it. And our posture may affect our ability to do so. And it may affect our systems. So it may affect our gaze. It may affect our vestibular system because our neck may not move as efficiently. So it's a big deal. So what can you do? Haha, I'm a PT. Exercise. So cardiovascular exercise, being mindful of taking your deep breaths. I love yoga. Yoga talks about breathing. It teaches us how to completely fill and empty our lungs. Strength training. I like to focus on the extensors. Rarely in PT do we get, in the geriatric or elderly population, do we get people doing a bench press? We're not doing that. Because we're trying to open you up to be able to use your strategy, stretching those muscles that have shortened. So we do a lot of this. We don't do a lot of this. We do a lot of hamstring stretches. We don't do a lot of quad stretches. So positioning. So as you know by now, the way you sit, the way you sleep, the way you use your devices are important. Healthy eating, I'm not an expert, but it's important for bone health. So making sure that your labs are normal, and if they aren't, getting your calcium and getting the appropriate nutrition. And of course, seeking input from healthcare providers. So this is just a visual for what you should look like when you sleep. So in terms of your neck, we naturally have a curve in our neck. It's not a forward head, but there's a curve in my cervical spine. And so that should be supported, but your head should not be pushed forward, and you shouldn't be hyperextended. If your chest is here, your head shouldn't be this way, okay? So nice, we like to say a neutral spine. So our head should be in alignment with our neck. Same thing if you're sleeping on your side, the line depicts kind of where your head should be. So her head is in alignment with her spine here. And then sleeping on your side, this is kind of that valgus position, that knock-knee position. So if you sleep like this long enough, especially if you're super skinny, you may be coming to see us for a little bit of bursitis, a little bit of pain along the outside of the hip. So making sure that your spine is in neutral, your hips are in neutral, just helps to prevent some aches and pains and shifts in your posture. Making sure that your assistive devices are appropriately fit, so you're not bent forward. When you stand in your walker with regular walking shoes, your elbow should be bent about 20 degrees. You shouldn't be reaching out this way. Your hips should always be extended. And this is just a quick refresher that I put in there for you guys on how to fit your device. Like I said, it's about a 20-degree bend in the elbow. And always size your device with walking shoes on. So if you wear shoes, don't size your device when you're barefooted. And then don't use your walker here, use it here. Trying to give you guys time to ask questions. And then, of course, if you already have aches and pains, I'm going to give you some exercises for posture. But if you already have a neck that hurts, a back that hurts, a hip that hurts, a knee that hurts, when you try my exercises, stop. So I am not a proponent for no pain, no gain. I like to say pain kind of alerts us that something's not right. So stop. If it hurts, stop. If you're feeling a stretch, which is usually mild and moderate, that's fine. But if you're having pain, stop. Okay? All right, so the first exercise is called a chin tuck, and this specifically addresses the forward head positioning. And really, you're starting by just trying to be as upright as you can, and you're moving your chin back in towards your spine. And you can do this sitting, you can do it standing, but I like to do it laying. And I stole these pictures from backintelligence.com. So I didn't make these. you look online and she has a nice array of pictures. These are ones that I thought was appropriate for the group. So backintelligence.com, I like her parameters for her exercises. Super easy, tuck it back. I usually like to say hold for about 10 to 15 seconds. You can do 3 at a time, but really it helps to shift that spine back into alignment. It's a great exercise, especially for those who sit all day at the computer. And then this is for the rounded shoulders, the flexed posture. I think I'm going to stay on this camera for now. And this is strengthening the extensor muscles, so the back muscles right in between the shoulder blades. First start, this is a resistance band that I'm using. And they're easy to get, but you don't need a resistance band. You could also do this just by getting to the position and holding. So what you don't want to do is shrug your shoulders up. You want to keep your shoulders back and down and just hold it for about 5 seconds. Come back in slowly and go back out. So you're holding on the out. So this one's a good one for the rounded shoulders. This is an advanced exercise. It's called the bird dog, but it's a good one for strengthening. And I'm going to shift forward just to see if there are any more before I make the camera shift. Actually, I'll do the doorway stretch first. So this one helps to those muscles that get super tight from being slouched. This is a great one to help open you up. So you find a doorway, put your hands on a doorway. Now, if you have shoulder pain, this may not be as easy to do, which is when you stop and don't do it, okay? But you can always play with the positioning of your hand to see if it does not hurt, okay? So you'd make a step forward, arms on the doorway, and you lead not with your head, because then you go into that forward head position that I don't like, but you lead with your chest. And you should feel a stretch right across your chest. You're actually stretching your pec muscles. Okay, and this one is a hold for about 20 seconds, and the parameters are on there. You can do that about 4 or 5 times. And for those of you who are having back pain, this is a nice one to kind of decompress your back. And you just find a kitchen surface or a sturdy surface, a counter. If you have balance problems, though, I would warn you to not do this one, okay? But you would grab a hold and just shift the weight back. And I'm not going to do it because you won't see me if I do it. But it's really just a good stretch to decompress your spine. So the next 2 are on the floor, so I'm going to ask them to shift my camera onto my yoga mat. So with the bird dog, if you can't get down onto the floor, probably not a good exercise to do. So if you're safe to get down onto the floor, you want to start with your knees about hip width apart. The wider your knees are, the easier it is to balance. Your hands should be right under your shoulders. Your weight should be through your fingers and not through your wrists. And you're going to slowly lift one arm forward, a leg back, and bring it back down. There's no hold. So if that's hard for you to do, just kick the leg back and bring it back down. Trying your best not to tip your hip back and forth. So it's a level hip. I'd prefer you have your tummy super tight. Kick back and come down. And you would alternate these. Just when you come down, just make sure to keep that nice wide base of support, because it's easy to kind of lose your balance in this position. And the last final one that I love, that I do all the time, is a bridge. So I like to do a bridge with your hands, your shoulders back and down on the surface that you're on. Interlace your fingers underneath. Draw those shoulders down to the ground, and you're lifting your bottom up, hold for 5 seconds, then lower back down, and then lift up. So these are your extensors. Your hamstring muscles, your bottom, and even your back extensors are working in this one. And you get to keep your shoulders back and down and stretch those pec muscles that keep you in that rounded position. So, a few exercises that are really good for your posture. Again, if you have a hard time getting into those positions, don't do it. Come see us if you need your help, or go see your provider and ask for input, okay? Thank you guys again for having me, and I think I'll take questions now. Hold on here, I think.
Oh, you'll have to get there.
You okay? Okay. Is that my question?
That is your question.
Oh, okay.
It's more of a comment.
Oh, okay.
Let's see here. Somebody said, this presentation was fantastic, very informative. Any questions I had were answered through the presentation.
Great.
That's awesome.
Thank you.
Yeah.
Nice compliment. Thank you so much.
Yeah, and we can wait here just another few seconds and see if any other questions pop up. If not, and actually, why don't I tell everybody about our upcoming programs, and then we can see here if any questions do show up. So, thank you. This was a great presentation, Celeste, and one that
I am going to mention one thing, because I think as providers we avoid talk about sexual function, but I did want to say that sexual function can actually be affected by our posture with what we call sacral positioning, where our pelvis is kind of tucked to our abdomen. You can actually have problems with your sexual function. So know that, if you do see your provider, and if somebody has said stop slouching, that can be affected as well. There's actually evidence that you have tightening of your pelvic floor muscles with that sacral positioning, and it affects your sexual organs from functioning. So just a little tidbit there.
All right. Thank you.
Yeah.
I'm going to just take this off quick because we are apart here, so you can understand me a little better. So great presentation. Celeste, and I will say this, has worked with my mother, and she is fabulous at what she does.
Thanks.
And she's as well a great educator here. So thank you for taking your time and doing this for us.
Of course.
I want to remind everybody, we have 2 programs coming in February centered around heart-related issues, because February is Heart Month. We have Charting the Course of Cardiac Diets. That's Wednesday, February 3rd at
2 p.m. Jolene Wolf, one of our dietitians, is doing that program for us. And then the other program we have is Thursday, February 25th, Your Heart as You Age, and that is Dr. Stuart Christensen, who's a cardiologist at McFarland Clinic. So I do not see any other questions. I do believe, another one that said thank you for a wonderful presentation. So
Welcome.
I think we're all in agreement.
All right,
So
thank you.
Thanks again, Celeste, and thank you for joining us, everyone.
Stay healthy, stay well, and use good posture. Have a great day.